Well, Dr. Kibler, welcome back to the show. It's a pleasure to have you again.
Thank you so much. Yeah, it's been a few years.
It has been a while. It has been a while. So for those of viewers out there who didn't have the opportunity to learn about you, tell us a little bit about your education and your background.
Okay. I'm a podiatrist. I'm a foot and ankle surgeon, and I did my training in Philadelphia at the University of Pennsylvania, and I did a foot and ankle surgery program there. It was a 4-year program. And then we moved to Charlotte after that residency and practiced there for a few years, and moved down here to the coast 10 years ago now. And it seemed time is really
Time goes
flying.
by, yeah, quickly, yeah.
And so we've been here now for about 10 years at Brunswick Foot and Ankle Surgery, and I'm the only physician there. We recently joined a larger group across the state of podiatrists. It's called the North Carolina Podiatric Physicians and Surgeons Group. We have approximately 45 physicians in that group across the state from mountain to coast.
Wow, and tell me a little bit about that group. What does that help you in terms of educational, CMEs, things like that?
Certainly from the educational standpoint, it's very nice to bounce things off of a variety of physicians. If you have a particular interesting patient or you're not quite sure how to go about something. But it's also very nice from a standpoint of trying to improve our best practices, where we can look at data, compare data, and try to make sure that all our patients are getting the best care that they can. And when you have a large group and you can share data like that, it is very helpful for that.
Well, that's excellent. Thanks for sharing that.
Well, you're welcome.
Now, you said your practice is Brunswick Foot and Ankle Surgery, and you've been there about 10 years. Tell me a little bit about the types of services that you provide at Brunswick Foot and Ankle Surgery.
Okay. We provide really the full scale of foot and ankle care, from basic podiatry services to taking care of the common corns and calluses and warts and toenail problems, to more the musculoskeletal problems of tendinitis and arch pain and hammer toes and bunions and flat feet and things like that. We provide services of X-ray imaging and ultrasound equipment and
in your office?
In our office.
That's convenient.
We have laser treatment. So we really run the full scale of what is available.
So there are quite a few services there. And today we want to talk about a few of the common problems that folks see. And I know I've certainly heard about bunions, but I'm not quite sure what that really is. So tell me about bunions.
Okay. A bunion is a deformity that develops usually as people age, but it can occur actually in children.
Really?
As an inherited genetic trait.
Oh, I thought it came from improperly fitting shoes.
and that is a contributing factor. But some of the genetic predisposition can lead the changes to develop over time, and it has to do with your foot type. Some people have a more loose foot type that can allow the bones in the foot to change position over time. And when the bones change position, the bunion develops on the side of the foot. And things such as tight-fitting shoes or dress shoes or high-heeled shoes, the pointy toes, can absolutely lead to that developing more quickly and sometimes more severely if you didn't use those type of shoes.
Well, how would you treat bunions? What do you do for them?
Well, the first thing we do is we ask the patient, is the bunion painful? If the bunion is not particularly painful and the patient's getting along just fine, they're actively doing exercise, they're going to the grocery store comfortably, they're going to work comfortably, and it's not really bothering them, generally we tell them to try to avoid shoes to make it worse. We try to give them some ideas to prevent worsening of the bunion. Sometimes arch supports or foot orthotics can slow the worsening of a bunion. And then we come back if it starts to become a problem or painful. And oftentimes we do see the patient back, but there's enough times where the patient never has a problem that we never really have to intervene. Sometimes if we have to intervene, we'll use wide toe box shoes as a starting point. Sometimes there's some padding that we can do on the side of the foot to try to cushion that area. things such as Advil or Aleve or Tylenol, if you can take those kinds of medicines, can be helpful to reduce the irritation. Open toe box shoes, shoes that don't rub on that bunion prominence. So those are the basic common things that we do right off the bat. If patients don't get better with those common things, then sometimes we'll suggest surgical intervention because a bunion that's left there for a particularly long time can get very difficult to treat as it gets worse and worse and worse. And there are a lot of good surgical interventions that we do nowadays that were really not done 10, 15, 20 years ago.
Right.
So times have changed an awful lot in how we correct bunion surgically.
Well, so it's not always a surgical procedure. It could be helped, maybe.
Yeah, it may be helped
in some
sometimes
other-
with changing in shoes, sometimes with arch supports.
Well, that's good to know because I think sometimes people think, oh, I'm going to have surgery, and I don't
Right.
want that. So,
Yeah.
Well, talk to me about hammer toes. I've heard that. I've heard that term several times. I'm
Right.
not sure what that is.
Yeah, a lot of people say, that, what is a hammer? You know, the picture is the toe like a hammer. A hammer toe is essentially a deformity of one of your small toes,
Okay.
not the big toe.
Okay.
And usually it's a deformity where the toe will sort of start to buckle up and
I
the
think my
knuckle
husband has
sticks.
that.
A lot of people do. More common in women, but men can have it as well.
Oh, really?
Absolutely. And when the knuckle does stick up, it can lead to a lot of issues. Number one is rubbing inside of shoes and pain, but oftentimes people get pain on the ball of their foot underneath the foot because of the hammer toe. And the hammer toe itself may not be hurting, but because of the deformity of the toe, it'll actually lead to a pain in the ball of the foot.
Is surgery indicated for something like that?
Again, sometimes. Oftentimes what we can do with hammer toes is we provide them with certain splints that will sometimes pull the toes down and reduce the pain.
Like straighten it out?
Yeah, it'll straighten it out. It doesn't necessarily permanently straighten it. I always liken it to as wearing a pair of glasses. You know, when I take my glasses off,
Can't see.
I can't see. But when I put my glasses on, I can
Right.
see. And the same thing with the splints is it helps to pull the toes down so they don't bother people as much in shoes. But in cases where the splints aren't working, Advil, Aleve, Tylenol, things like that aren't helping, and shoe modifications aren't helping, there are ways that we can actually correct the deformity of the toe. And again, it's tremendous changes in the past, even 5 years, on how we correct hammer toes. For years, we used to put pins in toes and have things sticking out of the skin when we have to do surgery. All of that has changed. And what we do now is we actually do a lot of internal work where you don't see anything after the surgery coming out of the skin except for some of the stitches on top. People have really been very receptive to that change as far as not having these pins sticking out of the toes when we have to correct the hammer toes.
Well, I know this is a really gross topic, but I really want to cover this, and that's toenail fungus. What is toenail fungus, and how do you get rid of it, and how do you catch it, and can you catch it from one another? And
Yeah, it can be contagious, if you will. It's not highly contagious, but it is a fungus. And if there's fungus around, and you can spread fungus to other people in the family through showers and through possibly sharing a shoe or something like that. But toenail fungus is an infection of a nail. It can happen in the fingernails as well, much less commonly in the fingernails. But it happens in the toenails because we're always walking around in shoes.
right.
And when we walk around in these shoes and socks and our feet sweat, that's a perfect breeding ground for fungus. Fungus is a type of mold, and mold grows in warm, dark
places.
moist places, and that's our feet. Oftentimes it develops on the skin first. It's sort of like an athlete's foot. A lot of people don't even know they have it. A lot of people say, well, my foot doesn't itch, it's not red. Oftentimes just a chronic dryness of the bottom of the foot is a chronic athlete's foot. And then that fungus can then get into the toenails over time, sometimes because of a mild injury that occurred, sometimes because shoes are fitting too tight and it irritates the end of the toenail. And sometimes it just is a natural progression of the disease. The nails get thicker, they start to get a little bit of debris underneath the toenail, they start to get discolored, and those are oftentimes signs of toenail fungus. There are some other conditions that can look like toenail fungus as well. Things like a skin condition we call psoriasis, skin conditions we call eczema. Things like that can also cause the nail changes to people think they have toenail fungus but aren't sure. So I definitely recommend getting an evaluation to see if you actually do have toenail fungus.
That's really great information. It's been a pleasure having you on the show today, and I have so many more questions, but unfortunately we're out of time. So please let us know how patients and local folks can make an appointment with your office. Could you give us that phone number?
Yeah, we're at 910-755-6512.
Okay.
And they can reach me on my website at www.drkibler.com. That's drkibler.com.
Great. And do you need a referral to see you?
You do not need a referral
Great.
unless your insurance carrier specifies it, but
Gotcha.
9 times out of 10, that's no.
Great. Well, thanks again for being here today. I look forward to seeing you again soon.
Thank you so much, Jim. It's a pleasure.